Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Eye color change surgery. How it works and safety. Eye color change surgery is used to change the colored part of the eye, called the iris, after an injury or other medical condition affecting the eye. It is also used for cosmetic reasons as a permanent alternative to colored contact lenses. /R/N/R/N. While colored contact lenses are the safest solution for cosmetic eye color change, surgery may be appropriate if a damaged or abnormally colored iris is causing you distress. Even so, the procedure may not be covered by insurance. /R/N/R/N. Eye color change surgery can permanently change your eye color by adding or extracting pigments or replacing the entire iris. /R/N/R/N. 3 procedures are used to change eye color. /R/N/R/N. Eye color change surgery is generally an elective procedure since the color of the iris does not affect vision. That said, if an eye injury or condition causes a color change and visual symptoms, for example, glares, halos, and light sensitivity, it may be a necessary part of reconstructive surgery. /R/N/R/N. Eye color change is sometimes an add-on to procedures like cataract surgery, lens implant, or corneal transplant. /R/N/R/N. Eye color change surgery is also used for purely aesthetic reasons and comes with considerable risks. /R/N/R/N. Each eye color change surgery procedure carries risks, including the potential for reduced vision and blindness. It is essential to discuss potential risks with your ophthalmology team. /R/N/R/N. There are medical indications for iris implants, and the benefits may outweigh the risks in these situations. Individuals with medical conditions associated with their irises, such as congenital abnormalities, can experience several types of visual disturbances, which an iris implant can alleviate or reduce. /R/N/R/N. However, many eye color change surgeries are performed for cosmetic purposes, and the consensus among eye care professionals is that the risks outweigh the benefits. The American Academy of Ophthalmologists issued a statement in January 2024 detailing the dangers of eye color changing procedures, as these procedures were trending on social media at the time. /R/N/R/N. The American Academy of Ophthalmology, American Glaucoma Society, and the Contact Lens Association of Ophthalmologists strongly discourage people from undergoing cosmetic iris implant surgery due to the potential damage it may cause to healthy eyes. /R/N/R/N. Laser keratopigmentation, also known as corneal tattooing, doesn't change the color of the iris but adds color to the cornea to conceal it. /R/N/R/N. Keratopigmentation uses lasers to create a series of circular tunnels of uniform depth in the cornea. A color dye is then injected into the tunnels. Robotic lasers ensure a more even color distribution than older needle puncture techniques. /R/N/R/N. Keratopigmentation is done with anesthetic eye drops to numb the eyes. Your head is strapped into a harness to keep it still, and a caliper-like device will hold your eyelid open and prevent blinking. The procedure may be uncomfortable but causes little, if any, pain. /R/N/R/N. Despite the accuracy of this technique, keratopigmentation is not without risks. While every effort is made to stabilize the eye and head, any accidental movement can lead to errors and possible injury. Other complications can arise after the procedure. /R/N/R/N. Possible risks of laser keratinization include /R/N/R/N. Laser keratopigmentation is contraindicated for people with corneal diseases or those who have had refractive eye surgery like LASIK. /R/N/R/N. Additionally, the long-term risks of keratopigmentation are unknown. /R/N/R/N. Keratopigmentation has a relatively short recovery time because the corneal surface is untouched and the dye is contained within the corneal tunnels. /r/n/r/n Most people can function normally within 2 to 3 days. Full recovery and healing can take anywhere from 1 to 3 weeks. Expect minor discomfort on the first day, followed by sensitivity to bright lights for up to 3 days. /r/n/r/n While laser keratopigmentation is an additive procedure, laser depigmentation is a subtractive procedure. /r/n/r/n Laser depigmentation, also known as photoablative iridoplasty, is used to lighten eye color by targeting cells that produce melanin, the pigment that gives skin, hair, and eyes their color. Dark eye colors are the result of high melanin production, while light colors are the result of low melanin production. /r/n/r/n Laser depigmentation is performed over a series of sessions. Low-energy laser beams heat the brown pigment on the surface of the iris and reveal the blue or green color underneath. The laser beams pass through the cornea without causing any injury. /r/n/r/n The procedure, performed with anesthetic eye drops, is said to be painless. /r/n/r/n Compared to the other eye color change techniques, laser depigmentation appears to be less problematic. Risks include /r/n/r/n Laser depigmentation is contraindicated in people with glaucoma. /r/n/r/n The change in eye color with laser depigmentation is not immediate. It can take up to 4 weeks for the body to reabsorb the brown layer and fully reveal the underlying blue or green color. /r/n/r/n There may be mild blurring, red eye, tearing, and light sensitivity an hour or 2 after the procedure. If iritis occurs, it tends to be brief, causing headaches, abnormal pupils, and light sensitivity. /r/n/r/n Iris implant surgery is a more invasive procedure that involves the insertion of a prosthetic iris to cover the natural iris. It is performed as an outpatient procedure using a local anesthetic. /r/n/r/n The technique was first developed in 1956 to repair iris defects caused by an injury, infection, or congenital defects like ocular albinism. It is less commonly used for cosmetic purposes due to the possible risks. /r/n/r/n Most iris implants are available in stock colors such as blue, green, brown, and black. People who desire color change in one eye may order customized iris to match the other eye. /r/n/r/n To implant the iris, the ophthalmologist makes a small incision in the cornea where it meets the sclera, white of the eye. The silicone iris is folded and inserted through the incision. The prosthetic is then unfolded and sutured into position over the natural iris. /r/n/r/n The risks of iris implant surgery are significant and sometimes severe, making them a less attractive option for people seeking an eye color change. /r/n/r/n Some of the most serious complications include /r/n/r/n Iris implants are contraindicated in people with glaucoma and diabetic retinopathy. /r/n/r/n For the first 24 to 48 hours after iris implant surgery, your eye may feel slightly gritty or scratchy, and your eyes may be teary and sensitive to light. It is not uncommon for your vision to remain slightly blurry for the first week or so. /r/n/r/n A protective eye patch may be needed to prevent you from touching or scratching the eye while you sleep. Recovery time can range anywhere from 2 to 8 weeks. /r/n/r/n Keratopigmentation. The cost of keratopigmentation can vary by provider and type of equipment used, but it generally runs about $12,000. /r/n/r/n Laser depigmentation. Laser depigmentation costs less than other eye color change procedures because it doesn't involve cutting into the eye tissue. Prices vary significantly by providers, ranging from $5,000 to $7,000 or more for both eyes. /r/n/r/n Iris implants. The FDA has not approved this procedure for any reason other than treating certain medical conditions. However, some individuals choose to travel overseas to undergo iris implants. /r/n/r/n notes that when done as an elective procedure without medical necessity, the cost of these procedures is out of pocket and not typically covered by insurance. /r/n/r/n if you are seeking to change your eye color for cosmetic reasons, temporary options allow you to do so on demand. /r/n/r/n colored contact lenses are the easiest option. Available in both prescription and plain lenses, there are several types to choose from. /r/n/r/n eye color changing drops are another temporary way to change your eye color, but they are likely unsafe. The American Academy of Ophthalmology issued a statement in August 2024 addressing their concerns. The drops are not FDA approved and claim to work by altering melanin levels in the iris. /r/n/r/n however, other essential eye structures, such as the retina, which is required for vision, rely on melanin. Side effects of eye color changing drops include infection, inflammation, and vision loss. /r/n/r/n if you wear eye makeup, you can also accentuate your eye color by framing them with different eyeshadows. Dark eyes often seem brighter with cooler, lighter colored eyeshadows, while blue eyes may seem more intense with warmer, darker color eyeshadows. /r/n/r/n eye colors will usually remain the same throughout a person's life. However, for some, melanin levels can change as they get older, making their eyes seem lighter. This is harmless and nothing to be worried about. /r/n/r/n however, several medical conditions can cause your eye color to change spontaneously. These include, /r/n/r/n if you notice the color of one or both your eyes has suddenly changed, see an ophthalmologist, as this may be a sign of a serious medical condition. /r/n/r/n several procedures can permanently change your eye color. Laser keratop pigmentation tattoos the cornea to conceal the underlying iris. Laser depigmentation removes pigment-producing cells covering the iris to reveal the blue or green color underneath. Iris implant surgery covers your natural iris with a soft silicone prosthetic. /r/n/r/n these procedures carry possible risks, some of which may be serious. None are FDA approved for cosmetic purposes. /r/n/r/n the safest option to change the color of your eyes is to have contact lenses prescribed by a qualified eye healthcare professional, such as an optometrist or ophthalmologist. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.